Hi, welcome. My name is Han, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. You might have heard a lot about immunotherapy in the last few years, and some of you may be getting immunotherapy. So let's demystify it, okay? So, immunotherapy is used as a way of addressing cancer, of treating cancer. So, by what the name itself means, the goal of this therapy is to increase the immunity of your body, of your cells, so that it can attack cancer with much more strength and with more stronger outcomes. So that's the goal of immunotherapy. It helps with destroying abnormal cells in the body and fighting those cells. So and at the same time, because immunotherapy is strengthening your own cells, your body recognizes it, so it avoids the destruction of your cells. So which means that many times the side effects that are associated with immunotherapy are much lesser, because your body is generally good at recognizing your own cells versus the abnormal cells in the body. So there are different kinds of immunotherapy. There is immune checkpoint inhibitor, there is T-cell therapy, there is monoclonal antibodies, there are vaccines that can be used as immunotherapy, and there are immune system modulators. Now, what's important when you're considering immunotherapy is to know your past medical history. So, what have you been experiencing before? What are other things that are going on? Because those may have some impact, or your immunotherapy treatment could have some impact in this area. So, if you have a history of any autoimmune disease, or you've had stem cell transplant, or breathing, or liver or kidney problems, any organ related issues, or any immune related issues, or pregnancy or breastfeeding, where the impact of the treatment could be felt on the baby, those kind of things you'll want to discuss with your medical team. Bring it up, make sure they're aware of it. Also, if you're taking any medications, then again, that's something to do a proper medication reconciliation, so that all your medications are logged and everyone on your team is aware about all the treatments and medications you are taking, to avoid any overdose or any interactions. I think one important point I want to mention here also is, for your own medications, you can look at, there are sites which I will post for you, where you can look at medication to medication interaction. So you can do that check yourself to see if there is any potential interaction between your medications. And if yes, then you can talk to your team about it. Okay, now the side effects that are typically associated with immunotherapy. So depending on the type of therapy, the side effects differ. If it is checkpoint inhibitors, then you may have rash or diarrhea or fatigue. I would say fatigue, feeling weak, difficulty with sleep, some anxiety, some depression, those are going to be common across almost all the treatments. Okay. With T-cell, there is also, nausea, headache that can happen. A rash can develop. So in that case, do get it checked by your provider. There can be fever. So some of these have fever associated with it. Like you can see with T-cell, monoclonal, and vaccine, all three have fever associated with it. Here, what you want to keep in mind is, when is it expected to have fever, and for how long, and up to what range of fever, and what you can do about it. Because if you're having fever during that time and you are aware and things are working, then that's great, that's okay. But if it is going higher than the expected temperature, or if you're having fever on other days when it's not expected to have fever, then those are things that you do want to get checked out. In addition to that, aches and pains are quite common in most of these treatments, and some headache, some weakness. If you're having trouble breathing, then I would suggest you still talk to your provider, because you want to figure out what to do about it and address it. Now let's talk about how this treatment is given. So it could be in many different ways. It could be given oral or IV or topical or intravesical. Usually it's given in your provider's office, or you're given the treatment at home if it is oral or topical treatment. Okay. The frequency of these treatments can vary. It depends on the cycle. So how often you're being given that treatment, what type of treatment, how often it is, how many days break, what is the dosage, and then depending on your cancer, depending on your tolerance, there could be some changes to this. Now, in terms of safety, I think that's an important topic. If someone is exposed to your chemotherapy, that is not expected, like, if you're breastfeeding and a child has it, or, somebody else took your medications by accident, then it is important to get some guidance on how to address it, because it is still chemotherapy and treatment at the end of the day. This is a very new and exciting, well, it's been around for a few years now, but it is a new and exciting branch of chemotherapy and treatments, which has been quite effective in for many cancers. So this one, you can talk to your provider and see if there are good immunotherapy treatments for your particular cancer. A lot of research is going on in immunotherapy in terms of predicting how a person is responding, and then how cancer cells could be, avoiding the treatment, and also what are the side effects associated with it. In terms of side effects with immunotherapy, a lot of times immunotherapy treatments are given long-term, or the long-term side effects are not so well known because the treatment itself has been out for a few years now. So it's important to keep a log of your symptoms and side effects that you've been having and how long, so that you are aware and you can work towards getting those addressed and discussing that with your medical team. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.